Hi, my name is Yixin Wang, and I'm going to give a presentation about leadership for beginning practice. This presentation is going to discuss work-related stress in nursing practice and how this issue influences patient safety and a healthy workplace. There are many studies on patient safety and a healthy workplace, which have mainly focused on practice errors. It is generally assumed that leadership may ease the harmful impact of work-related stress. However, only a few studies document this relationship. This presentation is going to talk about not only reported adverse effects, but also evaluations of work-related stress and its relation to patient safety and a healthy workplace. Throughout the presentation, I will utilize flowcharts and diagrams to deliver a visual effect to show the correlation between work-related stress, patient safety, and healthy workplace. Quotations of nurses' survey answers, nursing policies, and nursing standards will be extracted to deliver a better understanding of current nursing work environment and practice expectations. This information will help nurses who are experiencing work-related stress or concerned about their colleagues' health and well-being to gain a knowledge base of stress in nursing practice and how to develop or change their practice through leadership. Nursing is quite different compared to other health professionals due to its unique characteristics. Nurses' work environment can be influenced by numerous elements such as fast pace, lack of experience, and complex medical needs of the patient. Unfortunately, these aspects can create a stressful environment for nurses and thus result in negative outcomes for the patient. Also, work-related stress can contribute to the nurse's health. It was disclosed in studies that increasing job demands is one of the challenges for nurses. An increase in job demands can lead to inadequate time to properly prepare medications and medical equipment. Furthermore, nurses are experiencing difficulties to cope with heavy workload, including working with inexperienced team members, lack of staff, poor teamwork, inadequate time to discuss patient cases and to complete daily nursing tasks, doing heavy manual handling, and difficulty getting supplies and equipment. It was stated by nurses that there was a good deal of pressure just to finish daily tasks, and there is a negative effect on how much time was spent on each patient. Nurses had commented on their experience in a stressful workplace, including, "The truth is that we have to admit the patient as quickly as possible, and I feel now and again that there is not enough time for me, and this can have consequences regarding patient safety. Now and then I do not see the point in pressing through such an intense agenda. There are limits to what we can do. It is most dangerous when everything has to be done at an extremely fast pace." It was recognized that time management related stress can have negative consequences for the patient's safety. Health professionals have been found to have a high vulnerability to work-related stress due to hospital environment and a high degree of emotional strain. It is identified that caring patients is one of the commonest sources of stressors, including conflict between uncooperative patients, dealing with death, dealing with worried or angry family members, feeling helpless taking care of complex patients who will not get better. Long-term exposure to work-related stress can harm nurses' job satisfaction, and therefore can impact productivity, confidence, practice development, and health among nurses. All industries need positive and effective leadership to achieve their goals and values and to deliver excellent services. Leadership is the ability to motivate and mentor employees and innovate changes. Florence Nightingale once said that, let whoever is in charge keep this simple question in her or his mind. Not how can I always do this right thing myself, but how can I provide for this right thing to always be done. One of the key roles of nursing leadership is supporting team members. Nurse leaders should have the flexibility to work with their staff to facilitate them not only the quality of care but also the effectiveness and levels of job satisfaction. Sometimes the focus of our healthcare system is placed on business performance, while nursing issues are being neglected. Instead of separating a nurse leader from her or his fellow nurses, a collaborative culture is needed. Nurse leaders are required to develop inadequate nursing practice so that fellow health professionals can deliver safe and effective care. As new graduate nurses, we have the responsibilities to maintain our physical and mental well being, to deliver safe and effective care. According to the Code of Conduct for Nurses, nurses must maintain the following principles in their practice. Act to minimize the impact of work-related stress on their health and on their ability to practice safely. Encourage and support colleagues to utilize employee health services if they are concerned that their colleagues' health condition could impact their capacity to provide safe care. Seek help and advice from experts if they are sick or impaired in their capacity to ensure patient safety. Be aware of the risks of self-diagnosis and self-treatment and act to reduce the negative impact of their health condition. Take action, inform Australian Health Practitioner Regulation Agency if a nurse is aware of a colleague's illness or impairment which could negatively impact their ability to deliver safe care or put others at risk. To engage a safe and professional relationship with patients and family members, nurses must adhere to professional boundaries when nursing care involves close contact with the patient. To apply this practice, nurses must maintain the followings. In the case where the professional boundaries has been breached and ongoing care of the patient is needed, facilitate to transfer the care of the patient to another health professional. Take action when indifference, omission, disengagement, and disrespect are suspected, including escalating the problem to maintain the safety of others. So, how can we manage stress, and why is it so important to nursing practice? Researchers about stress management have proven its significant importance due to its potential impact on the physical, mental, and emotional health of the employees. Stress is the body's natural and non-specific response to any difficulty or danger. Healthcare facilities such as hospitals are recognized as stressful places for both patients and nurses. Stress coping strategies play a crucial role in improving nurses to deliver safer and more productive practice. Stress coping strategies should be taught to nurses, such as time management skills, work-related stress awareness, and muscle relaxation strategies, along with deep breathing exercise. So, how can leaders do this? The nurse leader needs to recognize sources and levels of stress in the work environment for his or her fellow nurses and find out the influence of stress management on the degree of stress. A common source of stressors stated by nurses is care delivery to patients, job demands, and workload. The nurse leader can incorporate stress management and relaxation workshops in nursing training curriculum. It is crucial to identify the stressors and high-risk groups during regular workshops. Hence, similar to stress management training, even stress identifying should be performed regularly for the safety of the patient and the nurses. Studies found that social support plays an important role in managing work-related stress and preventing emotional strain. The nurse leader should apply this finding to develop social support strategies to improve the emotional and physical well-being of nurses, and thus to improve the quality of nursing care. According to New South Wales Nurse Association, an employee assistance program is a mandatory service for all New South Wales public health facilities. As nurse leaders, it is important to offer employees with available services to help with stress management for nurses. Nurses should be given opportunities to discuss their worries and stress at work regularly with colleagues and supervisors and educators. And that's all for the presentation. Thank you for listening.